That's very informative. Now, you had mentioned that specific types of cancer are associated with a higher risk of developing a blood clot. What are those specific types of cancer?
Well, we've got a lot of epidemiological data, so data of thousands of patients, which will have looked at the rate at which people get blood clots. And we know that cancers such as brain tumours, so glioblastomas, pancreatic cancer, stomach cancer, esophageal cancer, lung cancer, ovarian cancer, these are all very high risk, as well as some hematological cancers as well, so myeloma, for example. Cancers which are less clotty are tumours like breast cancer and prostate cancer. But I see in my clinical practice a lot of patients with breast cancer who've had blood clots and a lot of patients with prostate cancer because they are such common cancers that although the proportion of them is small that get clots, it's so common I see many of them. The other thing is that people are living longer with cancer. Oncologists have got so good at treating cancer that people are living longer. They're living into older age with cancer, and they continue to have chemotherapy and systemic anti-cancer therapies, third line, fourth line. So the chemotherapy also increases the risk. And if you have metastatic disease, the risk goes up. So the way I look at cancer and a blood clot is that is a bar that you need to get above to get the clot. And you have lots of risk factors adding up. And when you have enough of them, it tips you over this threshold that you get a blood clot.
So speaking of risk factors, what are the thrombosis risk factors, and are there any that are increased with patients with cancer?
I think the most important things, there are risk factors which we can do nothing about. So one is age. We know that as your age goes up, your risk of blood clots go up. So that's irrelevant to whether you have cancer or not. Also, some people have naturally sticky blood. That's only a minority though. Anyone who's immobile, so if you've had surgery and you've taken to your bed, or you're having chemotherapy and you don't feel well and you take to your bed, those things will increase the risk. Being dehydrated will increase the risk. So you're not feeling well after chemotherapy, you're not drinking as much, you dehydrate, your blood becomes thicker. But in my practice, the most common thing responsible for people getting blood clots is chemotherapy and other anti-cancer therapies. They call them SACT, or systemic anti-cancer therapies. 60% of my clinical practice, people will have had the clots precipitated by chemotherapy. If we look at data, 53% of people who get a blood clot during the cancer journey do so in the first 3 months of their cancer diagnosis. Now, I'm sure that that is due to the fact that early on in their cancer journey, that's when they start their chemotherapy. So we often see clots very early on.